Okay, this is medication checkoff. This is a practice demo to kind of show you how the flow will go. When you first come in, there will be a table where you will be able to pick up a set of vital signs that should be on a little piece of paper for your patient. Your vital signs will state your temp, pulse, respiration, and blood pressure. It will also say whether or not your patient has experienced pain or nausea, and it will also state your patient's current blood sugar. When you first come into your med checkoff, you're going to have 3 sheets that you can pull out of the patient's chart. You will have a doctor's order and 2 MARs. You can set the patient chart out of your way and use your physician order and your MARs, and you're going to want to check your physician order against your MARs. Make sure that all the medications are on your MAR. So I'm going to go through and check all of my meds. I have a Practipred 40 milligrams PO/Q day, and you want to make sure that you're checking for the drug name, the right dosage, the right route, and the right frequency on each one of your drugs. And I'm not going to go through everything. You can see that you will go through everything. Make sure that you check every one of them. Make yourself some kind of a check mark that shows that you have checked them. You also want to check and make sure that you have the correct allergies listed. He has an allergy to K-Flex. His diagnosis is diabetes and pneumonia. And make sure that you have the correct patient's name and date of birth. Once I have done that, I am going to go through and set myself up for success. So I'm going to go through and I'm going to look at these, and I'm going to note which medications, since we're doing on a day shift, what my morning meds will be. I'm going to make a little dot next to my morning meds. Anything that says today or daily. I note that my patient's blood sugar is 225 this morning, so he's going to get a sliding scale dose of 4 units, so I'm going to mark that also. And I'm also going to note on here that I have 24 units of NPH to give, and my patient shows to be experiencing nausea, so I'm going to give a PRN dose of Phenegrin. Once I've marked which meds that I know that I want to give, I don't want to give a night dose, so I haven't marked that. I'm going to get ready to pull out all of my stuff. I have a tray here to take into my patient's room. I will need a med cup. I will also need alcohol wipes. If needed, there is a calculator in each one of the med carts to check any math that you will have to do. From here, I'm going to start with finding my patients on each drawer. They have a drawer. I'm going to find my patient's drawer for my PO medications. My patient has a Practicolase, and I'm going to look at it. This will be my first check. It's a Practicolase, 100 milligrams. Practicolase, 100 milligrams. It is by mouth, and it's every day. It's in pill form. It's not broken. Package is not ripped or torn, and it expires 11/20. That is my first check. I'm going to put it into the cup, and I'm going to make a check mark by that medication. My patient also has an order for Practipred. It is a 40 milligram dose. The Practipred that I have shows a 20 milligram dose. So I note that I need to have 1 more Practipred. And I have another Practipred. So I'm going to look at both of these, same as I did with the other meds. Practipred, 20 milligrams. It is oral form. The package is not broken. It's every day, and it expires 11/20. I have checked this one. Practipred, 20 milligrams for a total dose of 40. That expires 11/20. It is an oral route. I have checked that. That is my first check on that Practipred medication. I do not have any other oral medications on my MAR. So I'm going to go ahead and put this drawer away. I now show that I have a PPD, which would be a tuberculin test. So in the second drawer, I do not show any PPD medication in here, but I do find that I have TB syringes here. You need to make sure that you're checking. It does say TB syringe. Most insulin syringes are orange capped, and you will notice that most TB syringes have a gray cap. You always want to make sure you read because some things are different. So I am going to need that TB syringe. I have found the Practi-Pred. It is an opened vial, so I want to make sure that someone has dated it and signed it. They need to put the date and initials of when it was opened. If it does not have a date or initial, I'm going to discard it and I'm going to get a new container. Make sure anytime that you open a new container that you always date and initial it. I'm going to look at this. I have a PPD tuberculin. I'm supposed to use 0.1 ml. It's intradermal, and it's to be done today and read in 72 hours. Looking at my vial, I have a Practi PPD. It is 5 tuberculin units at 0.1 ml, and it expires of 20 and 20. That is my first check of the vial. I'm going to open my syringe. I'm going to grab some labels. I have my tuberculin syringe. I have my PDV vial. Since it is a multi-use vial and someone has already opened it, I'm going to use the alcohol and make sure that I clean the top off. Once I clean that off, I'm just going to let it sit there until I have my syringe ready. I'm going to draw that back to 0.1, which is my dosage. Once I pull that top off, I'm going to insert that air to 0.1, rotate that bottle, pull it back, making sure I do not have any bubbles in my syringe. I'm going to show this vial, and the syringe to my instructor. They've seen it. I'm then going to rotate it back, set it down, and pull that off. Anytime you recap a needle, either lay it down and slide it in, or with these, they stand up tall, put it back in, it is now covered. This is my PPD. You will label every syringe that leaves your med room. It is a PPD. It is 0.1 milligrams. Today's date and the initials. And you want to note the expiration date. Once I've done that, I'm going to make this into a small flag to put on my vial, on my insulin, my tuberculin syringe, so that I have that to check when I get into the room. I have now done my first check of my PPD. It's 0.1 milligrams. It's intradermal, which is in the correct syringe, and it expires in 20 and 20. I'm going to check off that first check. I'm going to lay this over here on my tray to go to my room, and I'm going to set my PPD to the side. Next, I have regular insulin sliding scale. I note that my patient's going to receive 4 units, but I also noted earlier when I was checking this that my patient also has a long-acting insulin. They have 24 units that's sub-Q BID. So I know that I'm going to have 2 insulins. One will be clear and one will be cloudy. So I will mix those. As in before, you want to make sure that you're checking those vials. If you use one that's a multi-use dose, make sure that it has the date and the time that it was, or date and the initials that it was opened. With NPH, you want to make sure that it's mixed by either rotating it in your hands, moving it back and forth, but don't ever shake it. I'm going to start with my regular insulin. I have regular insulin. I'm looking at it. It says regular insulin. It's a sub-Q, and it's done every AM. And I know that I'm going to get 4 units based on my 225 blood sugar. I have regular insulin that expires December of 2012. so it is still a good vial. I'm also going to check my NPH insulin, which is 24 units. I have NPH, 24 units. It's sub-Q BID, and it expires 2020. I note that I will need an insulin syringe. There are many different types in here. You have a 50 unit syringe, and you may have a 100 unit syringe. Decide based on your dosage. I have a 28 total. It's going to be easier for me to use the smaller 50 unit syringe than the 100 unit. So I've chosen a 50 unit syringe. I'm going to get both of my vials ready. Since both of them were opened, I will use alcohol to clean them off. And I have both of those ready. I note that I'm going to mix them, so I always go from clear to cloudy. So in going clear to cloudy, I want to put air in the cloudy first. And I know that I have 24 units of NPH, so I'm going to put in 24 units. And I'm going to show that to my instructor before I do it. I'm going to take that off. Insert that 24 units of air and pull that back out and set that back on top. I then note that I have to have 4 units of regular insulin, so I'm going to get 4 units. Show that to my instructor. And I'm going to put that in, put the air in it, pull it back to 4 units, making sure I do not have any air bubbles. If I note that I have an air bubble in there, I can take a pin and just lightly flick that, and it will get rid of those air bubbles. I now have 4 units. I'm going to show that to my instructor, and I'm going to set that back down and pull it out. I now know that I have to have a total of 28 units, so I'm going to go back, make sure that my insulin is mixed well, put that back into my vial, tip it up and pull out to 28, because that is the total units that I want. I have 28 units showing. I'm going to show that to my instructor. I'm going to set it back down, pull that needle out. With it laying down, I will recap that and set it. I'm also going to make my label. I'm going to show regular insulin, 4 units. That expires December of 12. And I'm also going to show NPH, 24 units, which expires in 2020. Make sure that I date it, and I put my initials on it. I now have everything on here. I'm going to set this to the side. I've now done my first check. I did all of my checks, so I'm going to mark those off and set those to the side. My patient was having nausea, so I note now that I'm going to give some Phenegrin. I have Phenegrin. It is reconstitutable, so I note on this vial, when I look at it, it says that it is to be reconstituted with normal saline. So I know that I need to have normal saline, and I find my bottle with normal saline. I know that I will have to have something to draw my saline, so I make sure that I have a 10 ml syringe and a needle. my Phenergan dose, it's 250 milligrams. I note that this is a reconstitution, so my easiest way to get a 250 milligram dose will be making this a 500 milligram per ml vial, and that means me adding 5.6 mLs. You want to make sure that you correctly add the correct diluent to get to the correct strength of medication that you want. So I'm going to clean the top of my normal saline and just let that set to the side. I'm going to pop the top on my Phenergan. I'm going to open up my syringe, open up my needle, screw those together. According to this, I want 5.6 mLs. I also want to make sure that I have checked this. It is Phenergan, it is Phenergan, and it's an IM, and it's reconstitutable. And it expires 11 of 2020. This states that I want 5.6 mLs of normal saline, so I'm going to draw this back to 5.6. I have 5.6, and I show that to my instructor. And I'm going to put that inside there, put the air in, tip my bottle back again, and bring that back to 5.6. Now that I have that where I want it at 5.6, there's bubbles, so I want to make sure I get rid of those. I'm going to tap that. Make sure all of my bubbles are out. And I'm going to remove that. I'm going to set it to the side. I'm going to recap this just to set it to the side for just a second, make sure that I have everything that I need. I'm going to insert it into the diluent, push that 5.6 in, pull it out, discard this into the sharps container because I will no longer need it, and I'm going to reconstitute my solution by gently rolling it in my hands or swishing it around. Once it is diluted, I'm going to look at this again. I now know that I have a 500 milligram per ml solution, but I need a 250 milligram dose. On a scratch piece of paper, I'm going to do my dimensional analysis, which shows me that I have 1 ml is over 500 milligrams, and I need to get a 250 milligram dose, which tells me that I will need to divide 250 milligrams by 500, which gives me a 0.5 ml for a 250 milligram dose. I know that this is an intramuscular injection, so I will have to pull out the correct needle and syringe. I have pulled out a small little 3 ml. Gets me to 0.5 mLs. I'm going to pull that back. Make sure that I wipe off again since I have been in this several times. Bring it back up. Pull back to my 1/2 mark. Get rid of any air bubbles that I may see. Show that to my instructor. If you happen to have that happen, my needle came out, you will take it, screw it right back in. Okay? I'm going to get rid of this needle anyway, because it has gone through that stopper and I don't want to go to my patient with a dull needle. So I know that this is a 0.5 ml. I know that this is 0.5 mLs. So in order to give my patient, I could give this in the deltoid. So I'm going to use a 25 gauge by 1 inch. You can actually use one that is a little bit smaller. You could probably use a half for the deltoid, depending on the size of your patient. The 25 gauge is a smaller needle. It won't be so painful for the patient. Now that I have that, I'm going to label it. I have phenagrin, 250 milligrams in 0.5 mLs. The date today, my initials, and that it expires on 11 of 2020. Okay. Did my first check on everything. I have everything ready to go to my patient's room. There's no other medications that I need. I'm going to do my second check here at the cart. So I'm going to bring all of my items back over. I'm going to start with my PO medication. I'm going to dump that right back out. And I'm going to go through it again. I have Practipred 20 milligrams. It expires 11 of 20. It is an oral route form and it's every day. And I note this is a 40 milligram prescription, so I will need two. I have a Practipred 20 milligrams that expires 11 of 20. It is oral form. I have checked both of those. That is my second check. I have Practicolase 100 milligrams. It expires 11 of 20. It is oral form. And there's no rips or tears. That is my second check. I now have my PPD. I'm going to bring that vial back over just for this one last check. I have PPD. I have PPD because I know I labeled it at 0.1. It's still at 0.1. It is intradermal. It is due today. And it expires on 20 of 20. That tells me that's my second check. I'm going to look at my insulin again. I have regular insulin. I know that I have regular insulin because I labeled it with 4 units, regular insulin at 4 units due to a 225 blood sugar. It expires December of 2012. That is my second check. I have NPH. I have NPH. It was mixed, it was diluted, it was 2020, expires in 2020. I know that I have NPH 24 units. According to my MAR, I'm supposed to have 24 units. That is my second check. I now check my phenagrin. Check my phenagrin. It is phenagrin. It is supposed to be a 250 milligram dose. 250 milligram dose. I know that I have a 250 milligram dose because I reconstituted this to 500 milligrams per ml, and I have a HFMNL in my syringe that I labeled. It expires on 11 of 2020. That is my second check. Now that I've done all of my checks, I'm going to make sure that I have alcohol with me for my injections. I also want to bring a Band-Aid for that nausea shot. I'm going to make sure that I bring my MAR with me when I go to the room. And I have everything that I need. And I'm going to go to my patient's room. Knock, knock. Hello. My name is Katina. I'm going to be your student nurse today. I actually have your medication. How are you feeling? Very good. Said you had some nausea. I've got something for that. Okay. Finding his ID band. I have his ID band, and I'm going to double check that ID band to make sure. Can you state your name and date of birth for me? This is Frank Johnson. His date of birth is 8/24 of XX. Very good. I just want to double check and make sure. Do you have any allergies to any medications? Stacy has an allergy medication to K-Flex. All right. I have checked. I want to make sure that I double check name and date of birth against the MAR. Always have it down here and double check it and have the patient state it for you. Once that's done, I'm going to explain to the patient that I have his medications. And I'm going to get everything set up to do my third check. In this situation, because I dropped them on the floor, they're still packaged. So I could reuse them because they are still packaged, but for the patient's benefit, I would state that I would go out and get new medications and come back. Okay, so I've gone out, I've got my new medications, I did 2 checks on them. I'm going to start with my oral medications. I'm going to make sure that my patient has a cup and water. If I don't have that, I'm going to grab it and make sure that I have a cup and water for my patient. After coming back in the room, you want to make sure that you double check the ID of your patient again. So I would go through and ask him his name and date of birth and double check that MAR again. I'm going to start with my oral meds. Exact same thing that I did last time. I'm going to go through these again. I have Practipred, 20 milligrams, that expires 11/20. It is in the oral form. It's not ripped or torn or broken. That will be my third check. At this time, I will pop those pills out into the cup. Both of them are in the cup, ready to go. Can you swallow okay? Do you have any trouble swallowing all these pills together? I just have 3. No? Okay, very good. So I'm going to go ahead and check off this Practicolase. Have my Practicolase, 100 milligrams orally every day. 100 milligrams orally every day. It expires 11/20. It is in pill form. And that is my third check. I'm going to pop that into the cup and have that ready to give to my patient. Okay, I have your Practipred and your Practicolase. I'll administer those to my patient and make sure that he has a drink. If he's laying down, we would sit him up to at least a 90 degree or whatever's comfortable for him. Okay, he's taking those meds. No problems with the swallowing. I'm going to go ahead and give him his insulin. I'm going to do my third check on my insulin. I have regular sliding scale insulin, 4 units, regular insulin, 4 units, expires 12/12. And I also have my NPH, which is 24 units, and expires 20/20. I have a total of 28. I verify I have a total of 28. Mr. Johnson, I have your insulin, and I'm going to give you that in your abdomen. You want to make sure that you put on gloves. Put on my gloves. I have my alcohol prep. I have my insulin. Mr. Johnson, I'm going to expose your abdomen. I'm going to pick my site. I'm going to clean that. And once I've done so, I'm going to remove the cap from my syringe and set it down. I'm going to grab a pinch of that fatty tissue because it is subcutaneous. I'm going to go in at a 90-degree angle, big stick. And I'm just going to stabilize that needle and push in that insulin.
Their book says 45 for sub-Qs.
Hmm?
Their book says 45 for sub-Qs.
45? My bad. Okay, 45 to 50 for sub-Q, depending on how large the patient is. Okay, so you want to go in at a 45-degree angle. Once you've given that injection, you'll pull it back out. Okay.
It's just trying to keep us from having to redo. I was trying to keep us from having to redo this whole thing.
Alright, okay. So I have given that one. My patient, I can now cover him back up. I'm trying to see where I've got a site at.
Nowhere.
I do. Okay. I also know that my patient's nauseated. I'm going to go ahead and let him have that phenegrin. I'm going to check my phenegrin. 250 milligrams. 250 milligrams, 0.5 mLs. I have 0.5 mLs. I note that. It expires 11 of 2020. It is intramuscular, and I have that. I'm going to give this in his deltoid. To mark that site, I'm going to find that clavicle, find that bony prominence where the shoulder meets, go 2 fingers width below, mark my V, note where and cite that, and then clean that area off. Once I have it cleaned, I'm going to remove my cap. I'm going to make sure I hold that skin taut. Go in at a 90-degree angle. Stabilize that needle. Make sure that I aspirate on all IM and push that in. Pull it out. Rub that spot, check for any bleeding. Go ahead and place that Band-Aid on my patient if he has any bleeding. And set that out of the way. Doing okay? Last thing I have to give is a PPD.
Just pretend.
The doctor has ordered you to have a tuberculin test. It's to check for tuberculosis. And it will go in your forearm. So I'm going to check this before I give it. PPD. I have a PPD at 0.1 mL. It's intradermal. I know that I have it. It is due today. And it expires on 11/6 of 12. That is my third check. I'm just going to borrow your forearm. Have that patient's forearm. I remove my cap and set it out of the way. And I'm going to go in just right underneath there. Make that small bleb. Once I've done so, I'm going to recap my needle. If the needles will not recap or have a safety feature, you want to make sure you take them immediately over to the sharps container. How are you doing, Mr. Johnson? You doing okay? I want to make sure that my patient's side rails are up. Make sure that my bed is in the low position. Make sure my patient has his call light. Is there anything I can bring you right now? No? Okay. I will check back on you then in a little bit. I'm going to make sure that you always gel in and out of your patient's room. Okay? You should have gel accessible to gel in and out. Okay? I will say that I have gelled out. I'm going to chart. On charting, okay, on your charting I have Practipred that I gave. You can see that I have my 3 check marks. I gave the Practipred. I'm going to initial that.
You're not having to put times.
No, they not put
I had them, but 9 o'clock. So I didn't.
You can note the time that you gave it. I gave that at about 10:50. You can see that I gave the PPD. I need to note where I gave it. I gave it in my patient's left forearm, and so down at the bottom you'll note that there's a left forearm, so I'm going to note that I gave that at 10:50. I'm going to initial it. I'm also going to put that I put it in the left forearm, LFA. I also gave my patient his Practicolase at 1050, and I'm going to initial that. And I gave him his sliding scale insulin, 4 units. I'm going to note the time, initial that, and I gave that in my patient's right lower quadrant, sorry. I also gave my patient the NPH insulin. I'm going to initial that and put the time. And I gave it in the right lower quadrant, RLQ. I also gave my patient the Phenergan. I gave that in the left deltoid. So I'm going to note the time that I gave it, initial it, and put LD for left deltoid. You want to make sure that you sign first initial, last name, your credentials, which would be SVN, and note your initials. You want to do that and make sure you do it on both pages. You also want to make sure that you write the date at the top of the page. Now I have documented, I have finished. I know that I did my 3 checks on everything because I've done my 3 checks. I'm going to make sure that before I leave my patient's room, of course, I brought them out with me, but I want to make sure that you get rid of these in the sharps container before you come out of your patient's room. Discard of any trash. Make sure you clean up your area and discard of any trash. Put the meds back where they go. Okay? This is an example. It is not, of course, there were some errors that you saw happen in here. You will see those. This is for you to be able to get the feel of how things should flow. If you have any questions, you can contact us, make it a time to come in and meet with any of the instructors whenever you have that time or they have time. You also get 2 practice times, which use those to the best of your ability. Hopefully this video will get you them that way.